Hi, welcome to my journey. Damn, last night I ended up eating way too much vanilla bark, right? That was supposed to go on the pecans. They all went in my stomach. Then, the big family pack of potato chips, I ate them all. Just about. I think I might have a cup left, right? And I don't even know why I was doing that. Maybe it's because I didn't have it in such a long time that I decided that overdoing it was just fine. I don't know. But I'm not going to let that stop me from my goal of at least trying to work out at the senior center for twice a week. I can do that. That's what I told myself. You can do it. You could do it. Okay? So, it looks like they're releasing some water pressure out of the fire hydrant. So hold on. Now, I am an emotional eater. Okay? So, last night I was trying to find some information on healthcare, right? So I'm like, let me go out here and see if I can find some information on the internet, right? So, of course, they have these apps that you can fill out information, and also they have, agents that bombarded my phone with phone calls. I'm like, what the hell is this? Right? Because it seemed like the only people that are really making money right now are the people that are dealing in insurance, specifically healthcare insurance, right? Because I'm sitting up here about 9 o'clock at night Central Time, right? 9 o'clock at night Central Time, trying to find out some information, right? Because I am confused, right? I'm confused. Like I said, most of the mail that I get are people who are trying to solicit me to come and allow them to sign me up on Medicare. Medical. Let's just say that. The way that they use terminology in America, because of our slang, because of our, style of speaking, right? You could get lost. You could get lost. In misunderstandings that you didn't even know was being a misunderstanding, right? So I go on and I tell them, look, because of course, I went and tried to get on with disability. Of course I did. And like I said, I was frustrated with that because, how do you get on disability and you don't have medical, and you already lost the connections of your doctors because you're no longer under their coverage. Okay, so you're not under their coverage, therefore you don't have access, right? When I was working at Amazon had what they call crossover, right? They had their own insurance, right? Medical insurance coverage, and they also had their own clinic, right? I thought that I was cool as long as, I had access to the clinic. And to me, it was worth it working at Amazon, just to have access to the clinic, right? But then when I went part-time, because I started feeling weak. It's like my age was catching up with me, right? But I started feeling weak, and and I was getting a lot of backlash, talking about I'm not up to par. And I'm like, how am I not up to par? What is the minimum? What is the minimum? What is it that you want? And how much time do I got to get to where you want? Right? These are the questions I was asking them. They didn't like those questions. They didn't. Right? But me, even though I may have a competitive nature at times, the majority of the time, it's just a fucking job. That's all it is. It's not my identity. It's just a fucking job. Okay. Calm down, Cherie. Because you're starting to cuss. Watch yourself. So, getting back to the point. So I'm online, and then all of a sudden, I fill out some information on this app, supposedly for healthcare.gov, right? I'm like, well, it said .gov. It's got to be a governmental agency, right? I'm not expecting no replies until at least business hours, right? Oh my God. I get texts by several different representatives. I get phone calls. So anyway, I decided to actually answer one because they actually, came up as a legitimate agency, on my caller ID. Because most of them, they were not coming up as legitimate agencies. They were just coming up as phone numbers, and did not have, their business name on my caller ID. Because, I don't answer a phone unless I know who they are, right? And at least if you let me know who you are, then we can just play the game that I know who you are. Okay? So, even when I don't. So, anyway, I answer the call, and I get across this guy who says, my name is Jason. You can call me Jay. I said, okay, hi, Jay. I'm Cherie. So, I'm telling him, I said, look, normally, I get my medical through my employer. I said, this is new to me. Okay? But I tell him specifically, I don't know what I'm supposed to do because, first of all, I'm unemployed. So he says, well, you have to have an income. I said, well, I do have an income. If I didn't have an income, I probably wouldn't even be able to call you. And he was like, okay. So I tell him, I said, I took the early retirement. I'm 64 years old. I took the early retirement. Right? And so he was like, okay, that's good. You got, how much do you get? How much do you get? So I'm getting excited. And the next thing he's telling me is, you're going to get tax credit of $1,590. And he's like, I wish I could get this, And I'm like, what? Right? We're not talking about you. We're talking about me. Right? But he was enthusiastic. He put himself into my shoes and made it seem like I was getting the best deal possible if I go with this plan that he found for me for $54 a month. And I think it was like $7,000 deductible. Right? But he said it was the least amount of out of pocket. Right? And I'm like, oh, that sounds pretty good, said, is that the best plan for me? And he was like, well, this is the plan that I think is the best for you, because if I put myself in your shoes, this is what I would probably get, because if I could get this plan, I would be ecstatic. I'm like, oh, all right. So what's covered in this plan? And he says, there's a universal plan, you're going to get the universal coverage. And I'm like, I don't know what the universal coverage is, because like I said, the plans that I have been on, they have been through my employer. So it was whatever my employer negotiated. I don't know, what is offered universally on a medical plan. And I said, this is part of the problem. This is part of the problem that I'm having, is, I'm not understanding, the language here. There's like miscommunication. I don't think it's miscommunication with me. I think it's miscommunication with them and the way that, their jargon is, because acronyms change depending on what industry you're in. What the contents of the framework is going to be, of the system that they're going to use, these acronyms, and how to define them. Okay? So, anyway, he's gung-ho and letting me know this is the best plan, this is the plan, and all I need to do is in order to get it started for January 2026, I need to give him the first month's premium right now. I'm like, right now? Right? I said, I don't get to look over the plan or anything or do any comparisons. Like, he then told me that he's a professional and don't waste his time. And I'm like, but I thought I told you at the very beginning that, I'm trying to, understand, different plans and what I have available to me out there, because my situation is different, because I'm like 8 months, before qualifying for Medicare, right? And at the same time, I do need coverage now, because I'm taking medication now. Okay? So, there are terms out there that I don't understand, like gap insurance or Medi coverage. There are a lot of terms that I'm not understanding, right? And then I asked him, I said, well, what about, is this Obamacare? And he was like, no, this isn't Obamacare. This is, this is real insurance. I'm like, oh, real insurance. Okay, that's nice. Real insurance. So I'm telling him, I said, see, you didn't gave me a quote for real insurance, and how do I know that's better than what I would get from Obamacare? So he says he doesn't handle that and he doesn't know what to tell me. I'm like, if you don't know, how am I supposed to know? right? So then he goes back into, damn, he better, try to close this sale deal, or else, just get off of the phone. That's what he did. He was like, well, ma'am, you can put these charges on a credit card. And I'm like, how do I know even what I'm signing up for? There's no paperwork. You just want my credit card number. So he's telling me, ma'am, we're a legitimate um um seller of insurance, and he is licensed, right? But you don't get no license number, right? You don't know if this is their real name. No. He said his name was Jason, call him Jay. I don't even know if the app is a legitimate app, because I don't know, right? We have apps that will carry an official name until they get caught, and because they're not official. Okay? So I'm trying to figure out, how am I supposed to compare this plan that he's trying to sell me with an Obamacare plan, which then I started realizing, I'm like, because I went to, and I talked to another lady. Another representative, and it was a lady. And she says, okay, Obamacare is America's nickname for the ACA plan. I'm like, the ACA plan? Yeah, the Affordable Care Act, right? And I'm like, but it seems like I should qualify for the Affordable Care Act because, I am on, retirement, and it is restricted on how much money I can make. And they also should have informed me that it's based off of your net accumulated income, right? Because say you have medical expenses, right? We know prescriptions can cost you a lot of money, right? You have your generic kind, you have your basic competition name brand, and then you have the deluxe prescription, which I don't even know what that is, but whatever it is, it's very expensive. It must be like the purity of the actual medication, kind of like, if you get that really pure drug, it's going to be a lot more expensive than if you got all those drugs that have cut downs or generic stuff in it. Okay. Anyway, that's one reason why you do have to give, drug dealers, credit. Street drug dealers, they at least can inform us of how, this some of the shit works, because otherwise we wouldn't know. I wouldn't know. I'm like, what do you mean? Generic. Because I remember asking a long time ago, what do you mean I can get generic brand at this lower rate than if I got it from this brand, right? But, then you offer me this other brand that's at thousands of dollars. And I'm like, I don't even know what that means. So, getting back to the Obamacare, right? So now I'm trying to get on Obamacare, right? When I go to the app, I guess I made myself a profile a long time ago, because I remember saying, I had made a profile when I was working to compare my employer's insurance coverage with the Obamacare. And I remember telling y'all that with Obamacare, right, they quoted me $660. Now, the one thing that Jason has stressed upon me was through Obamacare, any and all preconditions are applicable, right? Because some of them were like, preconditions, you're not accepted. Smoking cigarettes, you're going to be at this higher rate. And sometimes, this one lady, she has said, if you are extremely overweight and you're in the obesity, margin, they're not even going to accept you. You have to find a company that will accept you, and usually those companies will charge you an arm or a leg or maybe even a kidney. Okay? So, it is really complicated. Like I said, it's really complicated. I've been getting by using Telemed, right? I found a Telemed application online. These are doctors that can prescribe you what you need. They can help you, with basic, illnesses. And that's how I've been getting by, right? And getting the prescription that I need. One of the things that I did notice on, the coverages on one of the apps that I was filling out, as far as, what is covered, they will say Telemed is covered. So this morning I spent like an hour or over an hour, I'm not sure how long, talking to this lady, Mandy, right? And I told Mandy that, I was interested in comparing, the best rate to get the most amount of coverage for the least amount of money. She's like, oh, I understand. I said, I need the least amount of money because of my circumstances. I'm not making that much money. And, and I'm confused, right? Because we all know that back in 2024 or 2025, I'm not sure which one, but Trump had said that he was considering not taxing Social Security, right? So if Social Security is not taxed, does that mean it's not income? And if that's the case, now my mind is swirling like, oh my gosh, you could sign up for one of these plans thinking that you're going to get this tax credit of $1,500 at the end of the year, and then find out that, oh no, you're not going to get it because your income wasn't considered as income. Your SSI is not considered as income because it's no longer taxed. Right? And I'm telling her I'm confused. And she was like, well, I don't know either. I said, yeah. Can you imagine? You don't know. Imagine where I'm at. I'm like in the big sea trying to navigate. And I have all of these sharks coming at me telling me, pay this, do that, buy this, you know. And I'm like, why? And they're like, you should know. I'm like, I don't know, you know, right? Then when I tried to get somebody to send me some information, because I told them, I said, this is a lot for my brain to even conceive, right? You want me to conceive a gold plan, a silver plan, a bronze plan, right? The deductibles for each plan, the co-pays for each plan, the maximum for each plan, all this in my head, and I'm a senior, right? Because we first started out just looking at two plans, right? She showed me a gold plan, and I asked her about the silver plan. Because I told her, I said, it said silver. I'm a senior citizen. When you say silver, I think that applies to me. And she was like, no, girl. Silver plan is just a plan. I'm like, you mean it's not a plan for the silver senior citizens? She was like, no. I was like, well, I'm really confused now. Right? Because some way, somehow, they have plans that are available where you don't have to pay monthly, where you don't have to pay for anything, but it's getting to it is almost impossible. You have to have a representative that wants to give it to you, right? And most representatives, they don't want to give it to you. Why? Because that's going to affect their quotas. And also it will affect their revenue because they get referral fees. And I'm like, I don't even understand why the hell the government will sit up here and not just offer universal, but I do. And the reason why they won't offer universal is because the medical industry is so expensive, and the incentives for the doctors was so that they was going to get more money than the average person by sacrificing, 10 years of medical education, that they were going to end up being, more wealthier than the average person in the end. Let me go in here and try to do a workout, because I said I was going to try to work out twice a week, but I did want to get that off my chest about, this frustration that I have going on trying to get on medical, beings that, I didn't realize that, they no longer offered, the clinic, to employees, even if they didn't have medical insurance. So I lost that. Then I went on telemed, right? And, my finances, is really low. So I'm hoping they don't just, dissolve our contract because I wasn't able to pay them this month, and that I'll be able to pick it up late. Because through the telemed, I'm only paying like $30 a month in order to have access to a doctor, who will, keep prescribing me my medication. I was trying to get real coverage because eventually I'm going to have to go and get blood work. I could probably get blood work and then send my blood work over to the doctor and say, hey, Am I still good at this level of, thyroid medication? That's how I see it. How they see it may be completely different, right? Because last time I remember, you can go and get a blood work. It could cost you like $50, 150. Because that's what I had did at one point when I was unemployed, and I was paying cash to my primary care doctor. She was like, well, you're going to have to, get the blood work, send it to me, and then, we'll prescribe you the medication, right? But her, out of pocket for not having insurance was $200 for an appointment, right? And I was able to get the blood work, I think, for like $50. And she said, just have him send it over to her, right? Now, I feel like I should have a My Chart that's available to me. I'm serious. Of all my operations, all my doctors, all my conditions, because they have all of this on HIPAA. All of this has all been recorded under your HIPAA information. That's why they already know. They don't even have to ask you. The people that ask you is because they don't have access to HIPAA. Okay? But they'll send it to somebody who does have access, and whether or not it gets accepted or rejected, that's how that works. And I'm like, why are we playing this game? Why is America playing this game? Oh, it's about the money. Yeah, let's not forget, it's about the money.